Shoulder Arthroscopy. Introduction. Can you point to the cartilage? Choose one of the following options. Correct. The cartilage is a shock-absorbing, smooth material that allows smooth, painless shoulder movement. Which shoulder joint is damaged by arthritis? Choose one of the following options. Correct. This shoulder joint has rough surfaces and is damaged by arthritis. The surfaces of a non-arthritic bone joint are smooth. Are heart attacks and other anesthesia-related complications common during and after this operation? Select yes or no. Correct. Anesthesia is safe, but the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as heart attacks and lung problems. Blood clots in the legs after an operation are harmless. Select true or false. Correct. Blood clots in the legs are very dangerous. Even though they are unlikely to happen, they can cause death. Are infections very common after surgery? Select yes or no. Correct. Infections are rare. Though rare, infections as well as bleeding and scarring may occur. It is impossible to injure the nerves and blood vessels going to the arm in this operation. Select true or false. Correct. It is very unlikely but not impossible to injure the nerves and blood vessels going to the arm in this surgery. Although these complications are rare, they can still happen. The operation tends to be very successful. Select true or false. Correct. The operation is very successful, but complications may happen. Thank you for using Explain.